Hi and welcome back to my channel. So if you're new, please hit the subscribe button. I am talking about medicine, medical stuff, medical studies, and the life as a doctor here, and I'm planning to do some more videos in the future. If you haven't checked out my Instagram channel, please do so, and we are going to start. Today I want to talk about emergency medicine, why it has been a topic that, I don't know, I've always had a great amount of enthusiasm for emergency medicine. As a kid, I probably watched too many TV shows and series that focused on medicine and emergency medicine, so that is probably why I started to get into this topic and why I started to get interested in it. At the age of about 18, I did my civil service here in Austria, and I was lucky to be able to do that at the Red Cross and to work for the ambulance as a paramedic. So I started that and I began to work there, and it was very interesting, and I just learned so much about emergency medicine. I saw so many different things, so many different emergencies, and it is just so different from what you get outside a hospital and inside a hospital. Over the years, many things changed. After my service was done, I stayed as a volunteer for many years. So now it has been way over a decade, and I'm still doing some stuff there, mostly like training younger paramedics or other paramedics in emergency medicine, because I went to study medicine, I became a doctor. I'm now practicing for almost 4 years, and for me it was really interesting to watch my own medical career from scratch. Starting as a very young paramedic, then going to med school and becoming a doctor, and always learning more and more about the human body and how everything works and how you could treat different diseases, and also maybe get another view on certain emergencies. What else, if you're confronted with an emergency situation, it is not always clear from the start where it would go, because especially in a preclinical setting, you do not have the opportunities for your diagnosis that you have in a hospital. So it's basically you, your knowledge, your hands, your ears, and your eyes. And that is what makes it very interesting for me. And that is what I always liked. And also the fact that in emergency medicine you have to act quickly, make good decisions, and your decisions will matter in the future, because all those things that you do or that you do not do within the first few minutes or half an hour or hour will probably predict the way of the outcome of the patient. Not only survival or non-survival, but also how well the outcome will be if the patient survives. And for me, this always made it special, because you're out there, and if you're an emergency doctor, you're usually on your own. And in a clinical setting, you usually have your colleagues around, and you can probably ask somebody else, and you can build up a team depending on how fast you have to act. But in a preclinical setting, you do not have that. So you're more or less on your own, and you need to make fast decisions and hopefully very good decisions. And that is what makes it so special for me. And nowadays I'm still into emergency medicine, also intensive care medicine. I really like that because, in my opinion, that is a part of a medical field where you can do a lot for a patient that is really sick, and that is not comparable to many other fields. So I can understand anybody who wants to go into this field of especially emergency and intensive care medicine. But a little more about my way. So after all those years, I grew, and my knowledge grew, and I was more and more, I was able to do more because I was always better qualified. And this thing is still going because I am still not at the end of my medical education. And in the medical field, I also have to raise the question if this will ever be the case. But it is nice to look back and reflect on what already happened and what is probably going to happen in the future, because emergency medicine and the work for the ambulance, it sort of shaped me in my personality as a physician. So I always recommend, if people ask if they should try working as a paramedic, I would always say, yeah, why not? Because you see a lot, you learn a lot, and this is some sort of experience that nobody will be able to take away from you. And you can only profit from that. So if you are interested in studying medicine, if you probably already are studying medicine, or if you want to go to nursing school and you consider being a paramedic and get some experience in preclinical emergency medicine, I can only advise you to do so, because you learn a lot for your future way, and I think you handle patients differently at an early stage because you are used to being confronted with emergency situations and with making decisions, even at times where you probably would like to ask somebody who's more experienced than you, but nobody's there. So that makes you grow a lot, I think. So yes, if you have the opportunity, do so, try it out, and you will see, if you end up in emergency medicine, that is a very interesting field of medicine. So that was a little story how I started with emergency medicine, and I hope you liked it. And if you liked it, please give me a thumbs up and hit the subscribe button. And in future videos, I will probably talk a little more about emergencies that stuck in my head or still stick. And over the past 12 years now, being confronted with emergency medicine, I do think that I have a story or two to tell. So you will probably hear about them, or some of them. All right, see you.